Hi, my name is Dr. Gail Galetta, and I'd like to welcome you to the Great Emergency Medicine Baking Show. Today, we're going to be talking about items that can be commonly found in the kitchen or in your hospital pantry that can be used to treat common chief complaints. Now, we've all heard of drinking tea with honey and lemon for a sore throat or for the common cold. Did you know that black tea contains tannins which have hemostatic effects? If a patient presents with bleeding from a dental extraction site, you can place a black tea bag on that site to help control the bleeding. Honey, on the other hand, has anticoagulant and antibacterial effects. Honey can therefore be used to treat burn wounds. Lemons and other sour foods function as sialagogues, increasing salivary production. So if a patient presents with a salivary duct stone, you can have them suck on a lemon or another sour food to increase saliva production, thus increasing the pressure and helping to dislodge the stone. We've all heard of using milk and molasses as an enema to help relieve constipation. This works because of the sugar in the milk and molasses irritates the intestinal linings, causing increased gas, pressure, and peristalsis, thus improving the constipation. But granulated sugar can also be used to help reduce a rectal prolapse or paraphimosis. You simply place sugar on the prolapse or paraphimosis and wait for up to 15 minutes. The sugar will help absorb the edematous fluid, thus shrinking the prolapse or the paraphimosis, making them more easily reducible. Vinegar has commonly been used to deactivate nematocysts from jellyfish stings. It is not uncommon to find vinegar first aid stations placed along the coast of Australia for precisely this reason. Butter or another fatty food such as mayonnaise can be used to help patients who present with tar that is stuck to their skin. The fatty food will provide an emulsion that helps absorb the tar. Since marijuana has become legalized in many areas, we're seeing an increased number of patients presenting with marijuana hyperemesis syndrome. These patients will often note they feel much better when they're in a hot shower. So by using capsaicin cream from hot red peppers, this can help simulate a hot shower and relieve their symptoms. The mechanism behind this is not entirely understood. Cola, or another carbonated beverage, can be used to help dislodge clogged peg tubes. Cola can also be used to help relieve impacted esophageal foreign bodies. You simply have the patient chug a few sips of cola and then hop up and down on their heels. The increased pressure that this causes will help dislodge the impacted esophageal foreign body, thus saving the patient a trip to the endoscopy suite. Marathon runners and other endurance athletes are often prone to developing hyponatremia because they hydrate with free water. That is why you frequently find potato chips or other salty foods such as pretzels along marathon sites. Pretzels or potato chips can also be used to treat patients who have psychogenic polydipsia with resultant hyponatremia. And don't forget that moonshine kills. Before the days of fomepizole, ethanol was used to treat ethylene glycol and methanol toxicity. So the next time one of these patients presents, hand them a beer and say cheers. I would like to thank the Norwegian Society for Emergency Medicine and Teleflex for sponsoring this video. Thank you.